Hi, Dr. Larry Altshuler here again talking to you about healthcare and healthcare reform. Telling you things you won't hear in the media and you certainly won't hear from the politicians. Now, in my last video, I talked about the Affordable Care Act targeting two entities that they see as antagonistic to them, as enemies, for them controlling health care and telling you what you need to do, because that's what they want to do. They want to control these entities, but this is going to be very harmful to you. In the last video, I talked about how they're targeting health insurance companies. In this video, I want to tell you how they're targeting doctors, because in fact, the Affordable Care Act shows that it does not like doctors. Now, how can I say that? Well, number one, everything around the Affordable Care Act is attempting to decrease reimbursement to doctors. There's already the sustainable growth formula in Congress that reimburses for Medicare, and every year they decrease it and decrease it and decrease it. But the Affordable Care Act now has the IPAD, the Independent Payment Advisory Board, which is going to do the same thing, decrease reimbursement. And lastly, in President Obama's 2012 budget, he's included, again, decreased reimbursement to doctors. That's going to be really harmful. Because really, when you think about it, we want the best and brightest to be in medicine because it's your health, it's your life. But the best and brightest are going to see the government cutting down, and cutting back reimbursement. They're going to go into careers that they don't have to worry about the restrictions and worry about whether they're going to be able to make a decent living. Plus the fact we're already seeing all the family doctors leave, all the primary care is going to specialty care. They're disappearing, and this is the big reason, because they're starting to lose money on all this. Now, the second aspect of the Affordable Care Act is that it's very, very punitive to doctors. It's punishing to doctors. And you can really tell they don't like doctors. And I'm going to give you just three examples of accountable care organizations. If accountable care organizations do not save money, they're going to be fined. And they're going to be fined millions of dollars. That's one example. Then there's the value-based purchasing system, which is a huge part of the Affordable Care Act. Doctors are obligated or mandated to follow these measures that the government sets up and to report it to the government. And if they don't do that to the government's satisfaction, they're going to be fined again and penalized and lose money. Number three, information technology. Doctors are being mandated to buy computer systems, and they're having to pay for 2/3 of the cost, which are hundreds of thousands of dollars. And then they're going to again have to submit measures called meaningful use to the government. And if they don't do this, guess what? The government's going to fine them again. This is all the way through the Affordable Care Act. Everywhere you look, if doctors don't do exactly what the government wants them to do, they're either going to lose money, or they're going to be fined, or they're going to be penalized in some way. This is a very, very harsh act. It really works against doctors. Now, certainly, there are lots of doctors who overuse medicine and abuse medicine. There's greed out there. There's a lot of problems with that. But the majority of doctors don't do that. They just want to give you good medical care. But the government looks at medical care in black and white. They want doctors to do exactly what they want them to do. And medical care is not black and white. It is gray. Every patient is different. You can't treat patients black and white because the quality of care is going to go straight down. But that's what the government wants. That's what they're trying to do in the Affordable Care Act, and it's going to hurt all of us. I'm sorry to bring that news to you, but unfortunately that's what's going to happen. Now, if you want to try to avoid that, the best you can do is get knowledge and information about treatments and what's best for you and what can really help you and not help you. And for that, I urge you to go to my website, balancedhealing.com. There you'll find all the information that you need to help you get the most cost-effective medicine that you possibly can. So in the meantime, thank you again for visiting with me and listening to my video, and I hope that I've helped you a lot. And I hope you go to balancehealing.com and look at my other videos. Thank you.